This question is often repeated in all the exams. We have to discuss this very important question. In a cohort study, a study with case control design is planned without matching controls on calendar time and length of follow-up. The study design is best described as unmatched case control study, case cohort study, sub-cohort study, nested case control study. So, we will discuss this question. Now, the question says it is a cohort study. The first point is it's a cohort study in which a case control design is planned. So, I hope you know that within a cohort study, when you plan a case control study, a cohort study is already going on. A cohort in which already a cohort study is going on. From this cohort study, you collect the cases and controls. Then it becomes nested case control study. But without matching controls on calendar time and length of follow-up. This is the key question that is twisting the answer. Here, usually in nested case control design, the controls will be matched based on certain time and length of follow-up in the cohort. Do you understand? Because we didn't match, without doing this matching, when we do a case control study within a cohort design, then it becomes case cohort study. Case cohort study. What it means, from the same cohort, we are selecting the cases and controls. The cases will be selected after the disease has developed in the cohort, whereas controls will be selected irrespective of before the disease has developed in the cohort, they would have selected the controls. So what is the advantage of case cohort design? It can be studied for multiple outcomes. Very similar to nested case control design, except that in nested case control design, there is matching for controls for time and length of follow-up. So the designers, the study researchers, which design usually they will choose mainly nested case control design, because the analysis is not so complicated like case cohort study design. So I hope the answer is clear for you now. It is a case cohort study where the controls are selected from the cohort without any basis criteria of time or length of follow-up from the cohort. Whereas if the controls are matched, if the controls are based on certain time during the same time period, like case, this cohort is selected, the controls are selected, then it becomes nested case control design. For your understanding, I will explain with the help of a diagram what are the four designs. First one is case control design. In this standard classic case control study, the onset of the study occurs when the disease has already occurred in the community. The cases and controls, the outcome has already occurred. What we are doing, we are going back and selecting you are going back, and in history you are saying whether the cases are exposed or not exposed. Whereas controls also, they didn't develop the disease. You are going back in history records, you are searching whether the controls were exposed to the particular factor or not. So this is a standard case control design where the study starts after the outcome has occurred. Next one is case cohort design. See here, the cohort this one is the cohort. So from this cohort, we are selecting sub-cohort. This sub-cohort will be selected before they develop into disease or not disease. That is not a matter, but this sub-cohort will be selected and then cases will be selected. So this is a case cohort sample. What is the advantage of this case cohort sample? This is inexpensive. We are using the cohort data to do a case cohort study. But the thing is, even though it is not expensive, the analysis is very tedious and complicated. Whereas in a nested cohort study, as you can see, this is a nested case control design. Here also there is a cohort. From this cohort, we are selecting the cases and also we are selecting controls. So this is also an ongoing cohort study. From here you are selecting cases and controls, but the controls are selected based on certain criteria, like the same timeline in which the cases have occurred. Similar timeline controls will be. So there will be certain criteria for selecting the controls which will be absent in the case cohort design. But here there will be a criteria for selecting the control That is why it is nested case control study. And the advantage is this is also inexpensive. We are using cohort data in a very useful manner, and also the analysis is not so complicated like a case cohort design. So this is nested case control study. And the another option was sub cohort. There is no such a separate sub cohort. This sub cohort is actually a part of case cohort study. So simply to confuse us, they have given sub cohort. So from cohort, you are selecting a sub cohort. This is one part of case cohort. This is sub cohort is a cohort, and this is the case. So this is case cohorts. So now I hope you are clear about the different types of this case control studies, and in whichever way the question is asked, I hope now you will be answered this question successfully. If you like this video, press the like button. I will be posting regularly social medicine and community health videos, which will be very useful to crack your entrance examination. So kindly subscribe our channel. Thank you very much.